Good afternoon. Thank you for joining us today on Women Radio WFM 91.7. Compliment of the season to you. This is Nigeria's first radio station for women and their families. My name is Rose Yusuf Kaiser. You're welcome to the program The Big Question. This is a program where we discuss and provide solutions to issues affecting us as a nation and as citizens. And this program comes to you Mondays, Wednesdays, and Fridays at 12:05 p.m. All right, so today on The Big Question, we'll be looking at tackling gender-based violence in Kano, how CITAD's mobile app is empowering survivors to report cases. Now, this was a report done by a lady that we have heard from before. Her name is Mariya Shuaibu Suleiman. She's the reporter of this particular article that we are looking at today. And we know that when it comes to gender-based violence, we right here, at Women Radio, we definitely frown at it. And every opportunity we have to talk about it, we definitely get to do so. So today we'll be looking at the report by Mariya Shuaibu Suleiman. And the title of this report is Tackling Gender-Based Violence in Kano, how CITAD's mobile app is empowering survivors to report cases. Now, gender-based violence remains a pervasive issue in Nigeria. Now, it's talking about various harmful acts such as physical abuse, sexual harassment, and emotional manipulation. Now, in response to this, innovative solutions are being developed to address these challenges and support survivors. One of such solutions is the CITAD SGBV mobile app. That's a gender-based violence mobile app, which provides survivors with a confidential platform to report cases. A solutions journalism report by Mariya Shuaibu Suleiman, produced by Women Radio 91.7 in partnership with Nigeria Health Watch through Solutions Journalism Network, sheds light on how this app is transforming the fight against GBV in Kano. So we'll go ahead and listen to the reports before we bring in the reporter of this particular case in Kano. Now, while you do so, remember that you can follow us on our social media platforms, Facebook, Instagram, X, and of course YouTube at WFM 917, or visit our website at www.wfm917.com. The phone lines will be open shortly, but first of all, let's get to listen to Mariya's report, and then we get to follow up, and of course we get to understand why this report has had to be done.
Gender-based violence is a severe and pervasive issue in Nigeria, encompassing harmful behaviors such as physical abuse, sexual harassment, and emotional manipulation. In response to the crisis, the federal government enacted and domesticated the Violence Against Persons Prohibition Law in 2015 to address gender-based violence issues and ensure punishment of perpetrators. In Kano, reporting these incidents has traditionally been fraught with challenges. Many victims endure their suffering in silence due to fears of social stigma and lack of resources. For victims of sexual and gender-based violence, feeling safe enough to report their experience is critical in breaking the cycle of abuse. Confidentiality, trust, and protection from retaliation are essential to ensure survivors come forward, as underreporting allows perpetrators to continue their abuse unchecked. Data collection plays a crucial role in understanding the scope of sexual and gender-based violence and creating targeted interventions. In Rwanda, the establishment of ISANG one-stop centers has significantly improved reporting by providing survivors with medical, psychological, and legal support in a safe environment. By 2020, these centers had handled over 25,000 cases of SGBV. Additionally, data-driven approaches facilitated by Rwanda's Ministry of Gender and Family Promotion have been vital in assessing and improving sexual and gender-based violence, demonstrating how effective reporting and data collection can drive impactful change. Nigeria still faces challenges in collecting comprehensive national data on sexual and gender-based violence. Halima B. Farouk, an official at the Kano State Waraka Sexual Referral Center, revealed that many women and girls in the state experience various forms of violence, including domestic abuse, sexual assault, and psychological violence, but lack the confidence to report it. Waraka SAC, established by Kano State Government, provides crucial services for survivors of sexual and gender-based violence, offering medical assistance and legal support. Despite their efforts, the center collaborates with organizations like CITAD to reach a wider audience and address issues of confidentiality, stigma, and underreporting through innovative solutions like the GBV mobile app. According to Mrs. Zainab Aminu, a GBV activist and gender technical officer for the Center for Information Technology and Development, CITAD, CITAD developed the GBV mobile app in early 2022 to track and record GBV cases in Kano. The app provides a safe and confidential platform for survivors to report cases of GBV.
Most victims or survivors don't actually want to report because of stigmatization. So the idea of bringing the app came into play when we noticed that, okay, it's not as if these cases are not happening. They are happening, but people tend to not want to report. So why not we give them a platform where they can report their cases without anybody knowing who they are, what they are, and where they are, and but they can give a brief information about what is happening to them, and then if they want people to follow up on the case, they can have people to follow up on the case without their identity being compromised. So that's the major aim of us bringing up this GBV mobile app.
She added that the GBV mobile app is designed to address key aspects of GBV, including the environment where it occurs, the identity of the person reporting, and the nature of the perpetrator. One of its key features is allowing survivors control over their communication preference.
They can send us their report, and then they will give us the liberty to either contact them if they want. There is a slot in the app where it will say if you want to be contacted, you drop your phone number, then we can contact and then make referrals.
17-year-old Amina Usman, a GBV survivor, shares how the fear of societal judgment initially kept her silent, but discovering the CITAD app empowered her to report her case anonymously.
I didn't want to tell anyone about what happened because I was scared of what people might say. But when I found out about the CITAD app, I realized I could report my case anonymously. It also gave me the courage to come forward without anyone knowing it.
Ibrahim Salihu, a GBV mobile app monitor who is responsible for following up on reported issues and reporting on behalf of users, highlighted how the app has modernized the reporting process.
Yeah, indeed. CITAD GBV mobile app has changed the way I am working because it has changed from manual into technological aspects, because everywhere you are, if you get that information of GBV case, you have opportunity to report the case to the CITAD for the organization to take a serious action on that issue, and also to investigate further on that, not until you go to the CITAD directly and inform. No, through that mobile app you can report.
Salihu also described the thorough steps taken to ensure data accuracy.
We are undergoing a verification and investigation on any information that we collect. For example, if we get an information on so area on that case, we are trying to reach out a person or an individual who is living on that area, or if we can get an information of the relative, so that to contact him or to contact her on the case, so that to get accurate and exact information of what happened.
He noted that the app records different types of GBV.
We have a rape case, online harassment, sexual blackmail, sexual harassment, sexual abuse, and other related cases, and other cases that are related to gender-based violence.
After enduring a traumatic experience, 16-year-old Mariam Aminu, another survivor of violence, felt trapped by fear and was worried about her privacy.
I was scared to talk about what happened to me because I didn't want people to know. When I found the CITAD app, it was easy to use and I felt safe. I could tell my story without anyone knowing it was me. The app helped me connect with someone who listened and guided me on what to do next.
Since its launch, CITAD's GBV mobile app has significantly increased the reporting of GBV cases in Kano. One notable success was a spike in reports, with over 800 cases documented in a single year. And between November 2022 and February 2023, it monitored and recorded 171 cases of sexual and gender-based violence, with the majority being rape and other sexual abuse. The Gender Technical Officer also mentioned that while data for 2024 is still being compiled, the app has recorded a significant number of cases this year.
There was a period in the year where we had over 800 reports within that year. So we believe that those cases wouldn't have been able to see the light of the day without the use of our app. So for us, that's a success on our part, and we still urge the public to still use the app. The app is still functioning. It's called CITAD GBV app on Play Store, and you can also access it through our website.
She further explained the app's role in shaping advocacy efforts.
We collate this data, analyze them, and then it informs our press conferences that we carry out monthly so that we can call the government's attention to the rate of cases that are happening within Kano State.
One of the app's developers, Sohail Sani Abdullahi, reported that approximately 2,000 cases have been recorded since 2022. The data collected through the app, alongside other NGOs' data and their persistent advocacy efforts, highlighted the extent of child rights violence in Kano State. This collective evidence and advocacy created significant pressure on the government, which ultimately contributed to the passage of the Child Rights Bill, as the government recognized the urgent need for legislative action.
The high number of reported cases, a lot of actions were being put in place to see that to support both the victims and also ensure that justice is meted out to the perpetrators. Because during the period where we were collecting data and governments were forced to start responding to policy issues, and that was what prompted the Child Rights Bill to be to be passed in the House. Although we couldn't get the Violence Against Persons Prohibition Act passed as at that time, because the Attorney General said that they are merging it with the VAP code, that they can't adopt the VAP Act because of some cultural differences with the northern culture, so they can't pass the VAP Act. So, but aside that, we made progress a lot, because we had collaborations with NAPTI, with Human Rights Commission, with FIDA, that's the Federation of International Women Lawyers, and then the SAC Center too. So we're able to report cases, refer cases that need both psychosocial and medical support or legal support, and that helped victims to be able to seek justice. Before, nobody cares about whether somebody is raped or not, but when we started collecting data and informing press conferences and making press conferences, it informed the government that there is a serious case of SGBV. So we could see that has improved our cases.
In response to Zainab Aminu's statement on the role of CITAD's GBV app in tracking gender-based violence, Yakubu Muhammad Salihi, Director of Research, Planning and Statistics at the Kano State Ministry of Women, Children and Disabled, revealed that the ministry has recorded over 300 cases of rape this year, with victims including teenage girls and boys. These cases were reported based on data collected from the Waraka Sexual Referral Center, a key partner in gathering and sharing information on gender-based violence incidents. The director added that while the ministry has yet to provide details on cases directly reported through CITAD's GBV app, the app remains a crucial tool in tracking and forwarding cases for action. He also pointed out that the Kano State Ministry of Justice is revisiting the draft copy of the harmonized state VAP bill in conjunction with the review of the Kano Penal Code, which awaits validation. While political will remains a challenge, the ministry continues to provide psychosocial support, empowerment services and advocacy to create a safer environment for girls and boys in the state. Abdullahi Shehu, the Kano State Coordinator of the Human Rights Commission, echoed these sentiments, emphasizing that their agency works closely with law enforcement to respond to rape and sexual assault cases.
We do respond to cases of rape and other sexual offenses particularly when it's come to the report of the commission. Ideally, when such cases is being reported, the commission takes it diligently, working with other stakeholders, particularly, rape and other sexual offenses are criminal offenses which needs to be fully investigated by the law enforcement agencies, particularly the Nigerian police. So if we receive such case, we liaise with the Nigerian police to investigate the case and make appropriate steps in bringing justice to the victims.
He, however, noted that a lack of working laws, particularly the absence of the VAP Act, which Kano State is yet to domesticate, complicates the fight against GBV. The Kano State Police Command also uses the data from CITAD's app to handle SGBV cases more professionally. According to Abdullahi Haruna Kiyawa, the public relation officer of the command, the police diligently investigates cases, gathers necessary evidence, and ensures that perpetrators are prosecuted. Hawa Aminu, a concerned mother of one of the GBV survivors, expressed relief knowing her daughter had access to the app for reporting issues.
When she told me about the app, I felt relieved. I encouraged her to use it, knowing that she can report anything without fear. This makes me feel more secure about her well-being. Also, the Waraka Center helps her with medication after informing the police and checking her body.
The protocol officer of Waraka Center, Aminu Usman, highlighted that their collaboration with CITAD allows for efficient case handling. He said whenever CITAD forwards a case to the referral center, they ensure a swift response by connecting survivors with the police, legal support, and medical services. Despite these efforts, there are challenges, including limited app usage in rural areas, limited funding, and technical difficulties. Mr. Aminu explained that after the Ford's Foundation funding ended in 2023, CITAD has taken over the app's operation and maintenance.
Our limitations is lack of users. A lot of people are still not using the app. In the first period where we launched the app, a lot of people embraced it because we had monitors in several locations which we pay to follow up on issues and reports on people's behalf. But one of the major challenge is that after the period of the contract for those monitors expired, we expected sustainability for people to take civic social responsibilities in carrying out their responsibilities as citizens of Kano State, but people still expect us to pay them to be able to follow up on cases. So without them reporting the cases, those people that are vulnerable and marginalized in the digital space cannot report cases. That's one of our major challenges.
Saluhu, the GBV mobile app monitor, also noted that CITAD's funding for the monitors ended in 2023, leading them to stop reporting.
Initially, since from the beginning, when we were appointed as monitors, campus ambassadors of GBV, so the letter stated that we would work for 12 months, which is 1 year. But after that 1 year, they increased the duration to, I think we spent up to 18 months serving as GBV campus ambassadors. And each month they are paying us for the data and some stipend allowances. But since last year the project was ended, and most of us, I can say all of us, I don't know all, but most of us will stop reporting the cases through that GBV CITAD app, because the contract was ended. It was stated that it will be 1 month, and later it was extended to 1.5 years.
He added that they are unable to continue reporting because their contracts ended. The stipend was for both data collection and transport. To continue reporting, they will need renewed contracts and ongoing compensation. Sohail, the app developer, also highlighted the technical challenges involved in creating the app. He explained that the constant evolution of technology is a challenge because it requires frequent updates to the application to stay current with new development and features, making the process resource-intensive and time-consuming. Suhail explained that the app is available for download on the Google Play Store and through CITAD's website.
Currently, when someone wants to locate the application, he can just open his web browser. Maybe if you are using Android, you can open Chrome or Firefox or any kind of browser. If you are using iOS, you can also open your browser. Or if it is Windows computer, you can still open your browser. You can type citad.org.ng/GBV app. So whenever you open this, you can see the application here.
CITAD's GBV mobile app represents a significant advancement in addressing GBV in Kano. By providing a confidential and anonymous reporting platform, it empowers survivors who might otherwise remain silent. According to Usman, the protocol officer at Waraka SAC, the rise in the number of cases reported to them, reaching up to 100 per month through the app, and other cases reported directly to their office, reflects both increased awareness and continued prevalence of GBV in Kano communities. He added that with the existence of the CITAD's GBV app, they aim to make reporting more accessible, ensure that no case goes unaddressed, and encourage more people to utilize the app. Highlighting the broader impact of the app, the CITAD's Gender Technical Officer emphasized its potential reach beyond Kano State.
We believe that the app will not just serve only Kano State, can serve the entire nation as a whole.
This report was produced by Mariya Shuaibu Suleiman under Women Radio with support from Nigeria Health Watch.
Of course, now you've heard the reports. Of course, you can get the full report by visiting our website, www.wfm917.com, where you get to hear the full report and you get to also read the report there. So we'll just go ahead and bring in Mariya Shuaibu right now, the reporter of this particular report to you, and we get to hear from her. Now, the phone lines to be a part of this conversation today is 07000 917 917. You can send us a WhatsApp message to 070-317-56537. Our toll-free number for our female callers is 0800-1235917. Our toll-free number is 0800-1235917. And you can dial 07000-917-917. Or better still, you can also dial 09155-917-917 or 9155-917. 917. All right, so we have Mariya Shuaibu joining us right now. Good afternoon, Mariya. How are you today?
Yeah, good afternoon, Rose. It's a pleasure to be here.
All right, it's also a pleasure to have you to talk about this very important, aspect of women, what women are facing, especially in Kano State, coming from Kano State. So thank you for this well put together reports that you have done once again. All right, so let's look at.
Thank you.
All right, so let's look at some key insights that you discovered about gender-based violence and how it's been tackled in Kano while we were working on this story. What did you discover, especially as regards gender-based violence in Kano State?
Okay, so one of the key findings of this report is we found out that the app launched by Center for Information Technology and Development here in Kano to mitigate the cases of GBV here is actually empowering the survivors. Considering the fact that in the north, especially here in Kano, victims hardly speak up. They hardly report these cases. I mean, it's a very big issue when it comes to them speaking out, coming out to, report such cases to the relevant authorities. So one of the things that we found out is after CITAD realized that, okay, what can we do? Because it's one of the major problems. When they do not even speak up, you don't even have any data that you showcase and that will inform to implement policies that will help mitigate these issues in the state. So that's why they came up with this idea, okay, let us launch this app. It's an anonymous app that you can actually log into, lay your complaint. If you don't want your name to appear, you can actually just report the cases, tell them the exact the exact form of sexual harassment whatsoever, and then tell them the location, and they can actually follow up. So that's what they used to do. So one of the key findings is that the app actually helped to it helped in gathering data of these victims, and then so when CITAD recorded such data, they now forward it to the state government. And then one of the key achievements that we observed last year, between 2022 to 2023, that was last year, the data was actually, was able to help the government to pass the Child Rights Act bill in May 2023. So that's one of the key achievement of this, app, which was launched by the CITAD. I mean, it's actually helping.
Yeah.
And even though they couldn't tell us the exact data of this year, 2024, because they're still in the process of compiling it, but it's actually helping. And they're still receiving cases from different local government. Kano is one of the biggest states that we have in Nigeria, with almost 44 local government a year. So imagine getting responses from each of these local government of such cases. I mean, it's actually doing a great work here.
Okay. All right, thank you very much, because this is more like, a safe haven for those for survivors, for those who have gone through this. So yeah, this is definitely a good one. So this is Women Radio WFM 91.7. This is 25 minutes after 12 on this side of the radio. My name is Rose Yusuf Kaisar, and this is the program The Big Question. And today we are looking at a report done by Mariya Shuaibu Suleiman, and the title of this report is Tackling Gender-Based Violence in Kano, How CITAD's mobile app is empowering survivors to report cases. So you can do what to be a part of the program by dialing 07000 917 917. Send us a WhatsApp message to 070 317 56537. You can also dial 09155 917 917. Our toll-free number is 0800 1235 917. So these are different ways you can get in touch with us this afternoon, because myself and Mariya are here talking about this very important report. All right, Mariya, let me come back to you now. During the course of listening to the report, and even also going through the reports myself on the WFM website, share with us some real life examples, from the report, because there are some that you highlighted about for the benefit of those. All right, we have a call. Let's go with this call first before I come back to you. Hello, good afternoon.
Good afternoon, Presenter.
Good afternoon. What's your name? Where are you calling from?
My name is Modupe. I'm calling from Ibafo.
All right, Modupe from Ibafo. Go ahead. Let's hear you, Modupe.
Yeah. I'm also saying nice to the guest presenter soon.
Thank you.
My question is that how accessible is this SGBV app to persons with disability too?
Okay. All right. Thank you. All right. Thank you very much, Modupe, for calling and asking that question. All right, Mariya. So this is CITAD app for people, for survivors of gender-based violence, or anyone who is going through this. It is also opened for women with disabilities who are facing gender-based violence too.
Okay, I can say yes, actually, even though these they won't be able to report the cases themselves, and that's why CITAD employ GBV monitors. So so most of the these people with PWDs, what they used to do is they used to make a phone call to CITAD, and then CITAD will now send in their GBV monitors. They'll go to that local government and find out where they are. They'll go and speak to them. Then that GBV monitor will help them to submit the cases if they won't be able to do. Since they won't be able to do themselves. Although CITAD is actually working on that to see that, okay, PWDs have access directly to this app without anybody helping them, so that anytime they experience such thing, they can actually use their phones or whatsoever to report the cases directly. So it's something they're working on. But then before then, we have GBV monitors that are actually helping them to report the cases.
Okay, that's definitely a good one there. All right, so quickly let's go through some of the real life examples that you gave in the report. Just in few seconds, take us through how this impacted their lives, and having a conversation with them, or being able to speak with them. Did you really see the impacts? Were you able to feel the impacts of CITAD on some of the survivors?
Oh yes, exactly. I spoke with different victims, or we call them survivors actually, and based on their responses during the interview, I realized that it actually helped them, because one of them, she was, I don't know, it was a terrible experience for her. That I think it happened last year, and she couldn't speak up and all that. But then when she had the app, I think someone actually, I don't know, is a friend or somebody in the community, introduced her to this app, and then she was very happy that she could actually speak up. I mean, to them in the North, to even speak up is a very big issue. So for her to even have access to this app, it was like I don't know, like a help that came from the above. Okay, I can actually report this my case, and then probably they'll take it forward.
Yeah.
And so when she actually reported the case, I don't want to mention her name, yeah. So when she reported the case, sisters were able to track her down. So they call her that if she okay to, come over and share her experiences, so they can actually take it over. And then, with the help of her parents agreed, and then they went to the CITAD office, and before you know it, they linked them with, they took her to Sexual Repair Center here in Kano. They collected her data and all that, and then to the Kano Ministry of Justice. And, she was able to get help, and it actually helped.
Wow.
Because, we have to be doing this at all level, it's helped her. And the perpetrator, even though after he got arrested, and then, he was later released, but he was arrested, and then at least it makes some impact at some level. And she's very happy now. She's free. She can move around, so it's a good thing.
Okay. All right, thank you very much. And I'm sure that this will definitely get to encourage other survivors to speak up. So yeah, this is, has been a good one. All right, just as we wrap up the program now, what's your call to action, for the government, organizations, and even the public to ensure sustainability of, apps like CITAD, or maybe even other organizations that could come together to want to develop this app for different people, different survivors in different states, so that it can be easily accessible. What do you think, or what do you think we can all do together? The governments, different organizations, and even, we living in different communities.
Okay, yes, yeah. I mean, issues like this need a collaborative effort. We need every hands to come on deck and see that we fight this, and we make sure these victims got the justice they deserve and all that. So government play a key role in this. I mean, the data actually helped the Kano State government to pass the Child Rights Bill in 2023. So it's something that, we need government support as also. Because one of the challenges, most organizations, not only CITAD, I mean, we have few organizations that come up with this kind of innovative reporting platforms on GBV. So one of the challenges most of the times is funding. It's something that you need to be, we are talking about sustainability. It's not something that we are doing for this particular year, and so we finish it the next year. Like CITAD, they started this as a project under the Ford Foundation in 2022 actually, and then it ended. So it's now on them to now keep sustaining it with their own funding and all that, and it became a big challenge, seeing that. And GBV is actually a very big issue, because most of the times it did not end as the victim speaking up. No, we need to give them the support, empower them, make sure they get the justice they deserve. And make sure you empower them. If they need to go to school, send them to school, especially here in Kano. Most of these girls are not going to school because most of these cases happens mostly in rural communities.
Yeah.
So that means we even need community leaders at the grassroots level to, support us, give us all the support we need to collaborate with these NGOs. And this is one of the another challenge that CITAD is actually facing. A problem from community leaders again, aside from the funding. So it's something that we need government to support this kind of movement. We need the community leaders at the grassroots level. We need the media to be amplifying these kind of issues, like what Women Radio is actually doing now. Women Radio is in Lagos, we are in Kano, but see how people are now listening to us from different parts of the world. So it's something that we need to come together and see that we fight this together.
Okay.
I mean, that's my all call to action. It's a collaborative effort. Yeah.
Okay, thank you so much, Mariya, for coming on to talk to us about this, important aspects of what we're facing, of some of the ills that we're facing in our society. Thank you so much, Mariya, for taking our time also to go through with this report and bringing up all of these findings. Thank you.
It's my pleasure. Thank you for bringing me in.
Yes, to have a great day ahead.
Thank you.
Okay, so there you have it from the reporter of this article. That's how she had just told us how CITAD, and of course we also heard how CITAD's, GBV mobile app is empowering survivors in Kano to report cases and access justice. All right, let's just pick this last call before we go. Hello, good afternoon. Can you hear me? Oh, okay. Thank you very much for calling. But at this point, we'll definitely wrap up the program here. Now, Mariya's report highlights the innovative approach to addressing GBV through technology, shedding light on the challenges and progress being made. Thank you to the guest today, Mariya Shuaibu Suleiman, for an excellent report, and well done to CITAD for their effort in providing solutions. To read the full report, you can visit www.wfm917.com and look for the headline, Tackling Gender-Based Violence in Kano, how CITAD's mobile app is empowering survivors to report cases. Now, this report was produced by Women Radio 91.7 in partnership with Nigeria Health Watch through the Solutions Journalism Network. Thank you to each and every one of you who tuned in, and of course to Modupe from Ibafu for calling. All right, thank you to our guests too for being part of the program. Special thanks to our executive producer Tomo Kewale Shunaya. My name is Rose Yusuf Kaiser. Do well to keep your dial locked right here on Women Radio WFM 91.7.
WFM 91.7.